Hi, my name is Carl Pearson, and I'm creating this video to explain how I, or possibly you, as a representative small business person, would provide the two types of COVID-19 testing, the ventilators and the PPE, that is personal protective equipment, needed by healthcare and other emergency workers and the public. Assuming that I was the president or someone charged by him with a duty as a COVID-19 czar, and assuming that Congress and the president would provide the necessary funding, which probably would not occur. South Korea, you may be interested, appointed Pok-kee, a dermatologist, as COVID-19 czar for South Korea. President Trump appointed the White House Coronavirus Task Force, and then the Department of Defense established the COVID-19 Joint Acquisition Task Force, but neither of these two groups has solved any of the problems to date as far as I can tell. I invite your comments on ideas to improve or criticize what I am outlining. I'm trying to show that even now small business could solve the problem, except that you and I know, or at least understand, that we can always count on the federal government to do nothing to deal effectively with these problems. Perhaps there is too much money being made by insiders, or perhaps enough senators want to lower health care costs by letting the more vulnerable die. I haven't enough information yet to arrive at a firm decision, although it does appear that politics and private profits are heavily involved. I'm 83 years old, a practicing foreclosure defense attorney in the heart of New York, New York, a high school dropout. I received my BA magna cum laude in political science. I'm a graduate of Harvard Law School and have been a small business person for 74 years. Also, I ran on third-party tickets for New York Attorney General and New York City Mayor, and was one of 4 candidates seeking the nomination of the third largest political party for U.S. President, but lost to the candidate of campaign manager Roger Stone. Today is my 48th day of self-imposed quarantine or stay-at-home lockdown. The U.S. now has more than 1,160,000 confirmed cases and 68,000 deaths due to the coronavirus or COVID-19. I am one of the most vulnerable persons and take quarantine quite seriously. Here is what I believe a COVID-19 czar should have done and still should do. 1. Hire about 100 persons with purchasing, contracting, outsourcing, manufacturing, medical, and other skills to be determined to make up 4 teams of employees of the COVID-19 czar. 2. Identify each type of PPE, that is personal equipment, personal protective equipment that is needed, such as face masks, surgical masks, N95 respirators, gloves, hand sanitizers, sanitizing soaps and gels, and each of the replacement parts and the manufacturers of each. 3. Identify each of the various types of ventilators that are needed for use with needy COVID-19 patients, the replacement or substitute parts, and the manufacturers of each. 4. Identify each available test kit and components, including laboratory items, made anywhere in the world to test whether the tested individual currently has the COVID-19 virus, and the manufacturer of each of the kits and components. Identify each available test kit and components, including laboratory items, made anywhere in the world to test whether the tested individual has COVID-19 antibodies, and the manufacturer of each. 6. Assign 4 teams to handle one of each of the 4 main categories just identified, and individual team members to handle 1 or more items as appropriate, for the purpose of creating a contact list availability of the items, specifications for each item for setting up manufacturing facilities if needed, and identifying which companies or other organizations in the U.S. could manufacture the item, taking the needed changes, speed of conversion, and costs in mind. 7. Issue contracts for purchasing where possible and contracts to manufacture, and if a company or other organization is unwilling to, without adequate justification, is unwilling to sign, then require them to manufacture the items under the Defense Production Act of 1950. That law was enacted after the Korean War to ensure that the United States has enough supplies for its defense. 8. Maintain databases of users of each item, the changing inventory and needs of each user, and set up a system for the fair allocation of items as they become available. 9. Plan for creating federal warehouses for items not currently needed as a COVID-19 stockpile. 10. Make public reports and provide information and testimony to Congress and reports to the President. 11. Prepare a detailed budget for at least 1 year of operations, and after a few months update the first budget and prepare one for the second year of operations. 12. Finally, look into complaints of bidding wars and make sure the distribution system to be created does not contribute or condone bidding wars by U.S. users. I have tried to outline the ways a small business person could deal with the problems if appointed as a real COVID-19 czar. I invite you to make improvements or provide criticism, and who knows, perhaps some elected officials or their designees will adopt what we collectively have said should be done. Well, I've said what I plan to say, and I'll say so long until my next video.